If this program were to go away tomorrow, it would leave an enormous hole.
The Good Samaritan MAP program is a community program where they have a person who assists patients who need help applying for medications. Most of the patients are either on Medicare and have no prescription coverage or limited prescription coverage, or they may be just, without insurance and need help getting their medications.
My husband and I are self-employed, and being that we can't afford regular insurance these days, with the way the health insurance costs are, and having two special needs children, it's just everything costs so much, so there's just no way.
Almost all of the drug companies offer a program that people can apply for to receive their medications at a lesser charge, but the paperwork is difficult. Sometimes it needs to be online, and some of our patients don't have computers. And so the Good Samaritan Center has a person who's just really assisting all these people go through the process of applying for the programs.
They will call you and tell you when it's come in, and you come in, tell one of the ladies up front, and they'll call back to the pharmacy area. Somebody will bring the medication up front. You sign for it and pay for it. They'll ask you if you have any questions about your medication, and that's pretty much it. I mean, it's very simple, but they make sure that you're taken care of. It has helped me in the way that if it weren't around, I would not be able to afford my medications.
The Medication Assistance Program is dollar for dollar the most impactful thing that the Good Samaritan Center does. Among all the medical appointments, dental appointments, and everything else, we are able to help patients get their chronic medications for diabetes, hypertension, thyroid, asthma, that'll cost hundreds, even thousands of dollars a month, and we can get those for the patients where they pay no more than $100 a year for all of their meds. And then with that $100 worth of medications, they are staying healthy, they're staying out of the hospital, they're staying at work, they're able to take care of their children, they're managing their diabetes, their asthma, their blood pressure, whatever. The program costs us $35,000 in direct costs, so that doesn't count any overhead, that doesn't count the electricity, anything like that. That is direct program costs. We have a person who manages that program. She has 2 volunteers that help her manage that program. We have over 670 patients on the program, so she manages that. Then we have software that we have to lease that manages those 670 patients and their average of 3.5 to 4 meds each. So how we fund that is we do charge the patient something. We charge them a $5 per med admin fee when the medication comes in. That ends up at the end of the year being about $10,000 in patient fees, and that leaves us with a $25,000 deficit that we have to raise through fundraising. Our cash budget this next year is $950,000. So that means we're looking for $650,000 from donations. The last 2 years, we have been blessed by some bequests, but if we hadn't had those bequests, the center would have actually lost money in the last year. So this year, recognizing that, and we want to make sure we're sustainable, we're actually focusing a little more on grant writing and things like that, but we're also doing our best just to get awareness of us out there and in the public and hopefully generate as many donations as we can.